Alcohol. Alcohol fact sheet. Alcohol is a drug that has been consumed throughout the world for centuries. It is considered a recreational beverage when consumed in moderation for enjoyment and relaxation during social gatherings. However, when consumed primarily for its physical and mood altering effects, it is a substance of abuse. As a depressant, it slows down physical responses and progressively impairs mental functions. Defining alcohol comprehensively. Alcohol is a generic and or chemical names representative. It includes beer, about 4.5% alcohol, wine, about 14 to 20% alcohol, distilled spirits or liquor, about 50% alcohol. It also includes alternative sources like aftershave lotion, cough medicine, antiseptic mouthwash, vanilla extract, disinfectant, room deodorizer fluid, cologne, breath sprays, shaving creams, rubbing alcohol. Common street names include booze, juice, brew, grain, shine, hooch. Distinguishing characteristics of alcohol are pure ethanol, sold in some states as grain alcohol, is a colorless liquid with a distinctive odor and taste. It has a cooling effect when rubbed on the skin. Most commonly, however, alcohol is consumed as the component of another beverage, and grain alcohol itself is normally diluted with juices or other soft drinks by the consumer. Depending upon the concentration of alcohol in the beverage, the aroma of alcohol may serve as an indicator of the presence of alcohol in a beverage. Since the sale and distribution of all products containing more than a trace amount of ethanol are regulated by federal and state governments, the best guide to whether a specific beverage contains alcohol will be labeled information if the original container is available. Paraphernalia: liquor, wine, aftershave, or cough medicine bottles, drinking glasses, cans of alcohol containing beverages, can and bottle openers. Paper bags are sometimes used to conceal the container while the drink is being consumed. Method of intake. Alcohol is consumed by mouth. It is frequently consumed as pure grain alcohol. It is, however, frequently consumed in the form in which it is sold: cans of beer, straight liquor, glasses of wine. Alcohol is often consumed in combination with other beverages, mixers, either to make it more palatable or to disguise from others that alcohol is being consumed. Generally speaking, alcohol is absorbed into the blood relatively quickly and metabolized more slowly. Therefore, the potential exists for alcohol concentrations to build steadily throughout a drinking session. The table shown on the screen outlines some general effects of varying levels of BAC. 0.02 to 0.09%, loss of muscular coordination, impaired senses, changes in mood and personality. 0.10 to 0.19%, marked mental impairment, further loss of coordination, prolonged reaction time. 0.20 to 0.29%, nausea, vomiting, double vision. 0.30 to 0.39%, hypothermia, blackouts, anesthesia. 0.40 to 0.70%, coma, respiratory failure, death. Let's discuss the effects of alcohol on the individual. We have divided these effects in physical health aspect and other health effects. Now, take a look at physical health effects. The liver gets damaged due to alcohol. Liver is the primary site of alcohol metabolism and can be severely affected by heavy alcohol use. The three primary dangers are fatty liver, alcoholic hepatitis, and cirrhosis. Heavy alcohol use can also severely affect the gastrointestinal tract, contributing to inflammation of the esophagus, exacerbating peptic ulcers, and causing acute and chronic pancreatitis. It interferes with the absorption of nutrients from food and contributes to malnutrition. Heavy alcohol use affects the heart and vascular system, contributing to heart attacks, hypertension, and strokes, either because of direct action or indirectly through the malnutrition, liver disease, and other effects it causes. Alcohol depresses immune system functioning and increases the likelihood of infection. There is considerable evidence that alcohol abuse is associated with the incidence of cancer, particularly cancers of the liver, esophagus, nasopharynx, and larynx. Heavy alcohol consumption causes brain damage, manifested through dementia, blackouts, seizures, hallucinations, and peripheral neuropathy. And now, a glimpse at other health effects. In addition to having direct health effects through physiological changes in the drinker's body, alcohol contributes significantly to health problems indirectly. While most of the medical consequences of alcohol use listed above result from chronic use, these other effects can often result from a single episode of acute use. 1/2 of all traffic accident fatalities are alcohol related. The risk of traffic fatality per mile driven is at least 8 times higher for a truck driver than for a sober one. Falls are the most common cause of non-fatal injuries in the US and the second most common cause of fatal accidents. Research indicates over 60% of those dying in non-vehicular fires, fourth leading cause of accidental death in the United States, have BACs over 0.10%. Approximately 38% of those drowning, third leading cause of accidental death in the United States, have been exposed to alcohol at the time of their deaths. Between 20 and 36% of suicide victims have a history of alcohol abuse or were drinking shortly before their suicides. Alcohol also plays a significant role in crime and family violence, including spousal and child abuse. We are often asked a common question: does alcohol affect driver performance too? Yes, it does. The statistics reported above make it clear that alcohol can have a devastating effect on driver performance. By affecting vision, reflexes, coordination, emotions, aggressiveness, and judgment, alcohol deprives the professional driver of most of the tools he or she relies upon to perform safely. Hangovers also present a risk to driving behavior, as would other illnesses. The sick feeling associated with hangovers, including headaches, nausea, and other symptoms, can distract a driver's attention and lead to accidents even though alcohol may no longer be detectable in the body. What is alcohol overdose and how does it affect the driver or employees? Alcohol overdose, also known as alcohol poisoning or alcohol toxicity, occurs when an individual consumes a dangerously high amount of alcohol in a short period of time. It is a severe and potentially life-threatening condition. Alcohol overdose can occur due to binge drinking or consuming large quantities of alcohol rapidly. When someone experiences an alcohol overdose, their body becomes overwhelmed by the toxic effects of alcohol. This can lead to various symptoms such as confusion, vomiting, seizures, slow or irregular breathing, unconsciousness, and in severe cases, it can cause coma or death. It is important to recognize the signs of alcohol overdose and seek immediate medical help. If you suspect someone has consumed a dangerous amount of alcohol or is showing severe symptoms, call emergency services right away. Prompt medical intervention can potentially save their life. Alcohol at a given blood level produces less impairment in heavy drinkers than it does in lighter drinkers. Alcohol is toxic by itself and, coupled with the malnutrition common in alcoholics, can lead to kidney disease, deterioration of mental faculties, and psychotic episodes, the DTs, if the alcohol is withdrawn. The DTs are characterized by hallucinations and extreme fear, and their presence are a clear indication of alcohol dependence. Let's now talk about the signs and symptoms of use and/or abuse of alcohol. What are the evidence of presence of alcohol? Bottles, cans, and other containers which alcohol-containing beverages may have been purchased and/or consumed in. Bottle caps from alcohol containers, bottle or can openers, drivers drinking from paper bags, odor of alcohol on containers or on driver's breath. What are the physical symptoms? Reduction of reflexes, slurred speech, loss of coordination, unsteady gait can be noticed in physical form. What are behavioral symptoms? Increased talkativeness, reduced emotional control, distorted judgment, impaired driving ability, gross effects on thinking and memory. And now, the most important part. What are the different types of alcohol tests in the workplace? There are 6 main types, which we'll explain here. Pre-employment. Pre-employment alcohol testing is conducted as part of the hiring process, but it's optional for employers. It helps in ensuring that candidates do not have alcohol-related issues that might impact their ability to perform the job safely and effectively. Random testing. Random alcohol testing involves selecting employees for testing without prior notice or warning. This type of testing is done at random intervals and aims to deter employees from alcohol misuse during work hours, promoting a safer work environment. Reasonable suspicion testing. When supervisors or managers observe behavior or signs that suggest an employee may be under the influence of alcohol, reasonable suspicion testing is initiated. The decision to conduct this test is based on specific observations, and it is essential for supervisors to document their observations before proceeding with testing. Post-accident testing. Post-accident alcohol testing is performed after a workplace incident or accident, especially if it resulted in injury, property damage, or had the potential for significant harm. This test helps determine whether alcohol was a contributing factor to the incident. Return to duty testing. Return to duty alcohol testing is required after an employee has undergone treatment or counseling for alcohol misuse or a positive alcohol test result. It ensures that the employee is fit to return to work and has abstained from alcohol. Follow-up testing. Follow-up alcohol testing occurs after an employee has returned to work following treatment or counseling for alcohol misuse. It is conducted at regular intervals to monitor the employee's continued abstinence and compliance with the workplace alcohol policy. Everyone, please note that alcohol testing in the workplace must comply with local laws and regulations. It is essential for employers to have a clear alcohol policy in place and to train supervisors and employees on the procedures and implications of alcohol testing. Testing should be conducted professionally and confidentially to respect the privacy of employees while ensuring a safe and productive work environment. Some other rules and regulations related to alcohol use for covered employees. Alcohol concentration. Employees are not allowed to report for duty or perform safety-sensitive functions if their blood alcohol concentration, BAC, is 0.04% or higher. Alcohol possession. Operating a commercial motor vehicle while in possession of alcohol is strictly prohibited, except when the alcohol is part of a shipment and properly manifested. On-duty use. Using alcohol while performing safety-sensitive functions is not allowed. Pre-duty use. Employees must not engage in safety-sensitive functions within 4 hours after consuming alcohol. Use following an accident. After a reportable accident, employees must refrain from alcohol use for 8 hours or until they undergo a post-accident alcohol test, whichever happens first. These rules are in place to ensure the safety of employees and the public when performing safety-sensitive functions, particularly in industries involving driving commercial motor vehicles. It is crucial for covered employees to adhere to these regulations to maintain a safe work environment and prevent accidents related to alcohol impairment. So, how would alcohol testing be conducted? The alcohol screening test can be conducted using any of the following approved devices by the National Highway Traffic Safety Administration: evidential breath testing device, non-evidential breath testing device, saliva testing device. If the screening test is positive, the confirmatory test must be conducted using an approved evidential breath testing device. The DOT mandates that the confirmatory test be performed no earlier than 15 minutes and no later than 30 minutes after the screening test. Individuals conducting alcohol testing must undergo proper training to operate the specific device used for testing. Adhering to these guidelines ensures accurate and reliable alcohol testing for safety-sensitive employees, particularly in industries involving commercial motor vehicle operations. Conclusion. One main reason for conducting this training is to identify alcohol use disorder, which is also known as alcoholism. You can look for these signs to identify alcoholism: exceeding planned drinking limits or drinking for longer than intended, unsuccessful attempts to cut down on alcohol consumption, devoting significant time to obtaining alcohol, getting intoxicated, or recovering from drinking, strong cravings or urges to drink, failing to fulfill obligations such as work, school, or family responsibilities due to alcohol use, persisting with alcohol use despite relationship problems, giving up important activities to drink, engaging in risky behavior such as drinking while driving. Recognizing these signs is crucial in understanding the extent of alcohol use disorder and seeking appropriate treatment and support for affected individuals. Overall, this drug and alcohol testing training has been designed in such a manner as to play a vital role in promoting safety, compliance, awareness, prevention, and intervention within the DOT, contributing to a safer working environment and your overall well-being in the public.